Good morning. You're watching News for Hearing Impaired. I'm Preeti. With me is Manisha. First, the headlines. 17 Indian soldiers critically injured during the standoff between Indian and Chinese troops succumbed to injuries and exposure to sub-zero temperatures in high-altitude terrain. A total of 20 Indian soldiers martyred at Galwan Valley. Agency reports say 43 Chinese soldiers also killed in the action. Raksha Mantri Rajnath Singh takes stock of the situation after the Galwan Valley incident. External Affairs Minister, Chief of Defence Staff and 3 service chiefs attend high-level meeting. Raksha Mantri briefs Prime Minister Narendra Modi about the incident. United Nations expresses concern over violence and deaths at line of actual control. Prime Minister Modi to continue interaction with Chief Ministers of States and Union Territories today following the first round on Tuesday. Prime Minister says the pandemic remained under control in India due to right decisions at the right time. Says the country gave superlative example of cooperative federalism. India's battle against COVID-19 goes from strength to strength as the recovery rate goes up to 52.47%. Over 1.8 lakh patients cured and discharged, with active cases in India standing over 1.53 lakh. Over 8.1 million global active cases of COVID-19 with over 4.4 lakh fatalities. The United Nations General Assembly to hold elections today for 5 non-permanent members of the Security Council under the new voting arrangements due to COVID-19 restrictions, with India assured of a win, being the sole contender for the Asia-Pacific seat. US President Donald Trump signs executive order on police reforms following weeks of protests against racial injustice in the country. Trump's proposal steers the state funding to police that will get independent certification while banning chokeholds unless an officer's life is in danger. Indian Army has said that 17 Indian troops who were critically injured in the line of duty at the standoff location and exposed to sub-zero temperatures in the high-altitude terrain have succumbed to their injuries, taking the total that were martyred in the action to 20. Indian and Chinese troops have disengaged at Galwan area, where they had earlier clashed on the night of 15th and 16th June. Indian Army has reiterated that it is firmly committed to protect the territorial integrity and sovereignty of the nation. And according to the agency reports, 43 Chinese soldiers were also killed. For nearly last 5 weeks, a standoff has lingered on between Indian and Chinese armies in Galwan Valley and other areas of eastern Ladakh. Talks have been held at various levels, going up to Corps Commander to resolve the situation. But what happened on Monday night has set back the de-escalation process. The MEA has also clarified that it was the Chinese side that departed from the consensus to respect the line of actual control in the Galwan Valley, leading to clashes on 15th and 16th night. The MEA has said that India and China have been discussing through military and diplomatic channels the de-escalation of the situation in the border area in eastern Ladakh. Senior commanders had a productive meeting on 6 June and agreed on the process for such de-escalation. Subsequently, ground commanders had a series of meetings to implement the consensus reached at a higher level. While it was our expectation that this would unfold smoothly, the Chinese side departed from the consensus to respect the line of actual control in the Galwan Valley. On the late evening and the night of 15th June, a violent face-off happened as a result of an attempt by Chinese side to unilaterally change the status quo there. Both sides suffered casualties that could have been avoided had the agreement at the higher level been scrupulously followed by the Indian side. Given its reasonable approach, it had to be implemented by the Chinese side, and given its responsible approach to border management, India is very clear that all its activities are always within the Indian side of the LAC, and we expect the same of the Chinese side. We remain firmly convinced of the need of maintenance of peace and tranquility in the border areas and the resolution of differences through dialogue. At the same time, we are also strongly committed to ensuring India's sovereignty and territorial integrity. Raksha Mantri Rajnath Singh also held a high-level meeting yesterday and took stock of the situation after Galwan Valley incident. The meeting, chaired by Raksha Mantri, was attended by Chief of Defence Staff General Bipin Rawat and the three armed forces chiefs. External Affairs Minister Dr. S. Jaishankar was also part of the deliberations. The prevailing situation was assessed during the meeting. The Defence Minister briefed Prime Minister about the situation after the meeting. Sources informed that in the middle of all this, Pathankot military station visit of the Army Chief has been put off. Raksha Mantri also briefed Prime Minister Modi about the incident. United Nations Secretary General Antonio Guterres has expressed concern over the reports of violence and deaths at line of actual control between India and China and urged both sides to exercise maximum restraint. Associate spokesperson for the UN Secretary General made the comments at the daily press briefing. She was responding to a question on the martyrdom of Indian Army personnel in a violent face-off in Ladakh's Galwan Valley amid escalating tensions at the LAC. In her response, she said, and I quote her, "Yes, we are concerned about reports of violence and deaths at line of actual control between India and China, and we urge both sides to exercise maximum restraint. We take positive note of reports that the two countries have engaged to de-escalate the situation." The United States is closely monitoring the situation following a fierce clash between Indian and Chinese forces in eastern Ladakh and hopes that the differences will be resolved peacefully. Washington also offered condolences to the families of the 20 soldiers that have been martyred. A State Department spokesperson said, "Both India and China have expressed their desires to de-escalate, and the US supports a peaceful resolution of the current situation." He added that during their phone call on June 2nd, President Donald Trump and Prime Minister Narendra Modi had discussed the situation along the India-China border. Prime Minister Narendra Modi will continue his interaction with Chief Ministers of States and Union Territories today as well. Now, this is Prime Minister's 6th interaction with Chief Ministers in the COVID era. On the first day of virtual meet, that is yesterday, Prime Minister said the pandemic remained under control in the country due to right decisions taken at the right time. He added that recovery rate has gone beyond 50%. He said that the country gave superlative example of cooperative federalism. Prime Minister Modi reiterated the life and livelihood mantra. He said that there is need to increase testing and tracing along with picking up economic activity and health services. Prime Minister also laid stress on wearing masks and social distancing. He said even a little carelessness will weaken the country's war against COVID. Prime Minister noted that with the efforts of the past few weeks, green shoots in the economy are visible. He also said that there has been rise in power consumption, which was earlier falling. Also, fertilizer sale in May this year has seen a significant increase. Apart from this, there is a healthy increase in kharif sowing in comparison to last year. The production of two-wheelers is also increasing. The digital payment in retail are reaching pre-lockdown level, increase in toll collection in May, and inevitable bouncing back of exports. On the second day of the two-day virtual meet that will be today, Prime Minister will interact with another 15 states and union territories. Now, this includes Maharashtra, Tamil Nadu, Delhi, Gujarat, Rajasthan, Uttar Pradesh, Madhya Pradesh, West Bengal, Karnataka, Bihar, Andhra Pradesh, Haryana, Jammu and Kashmir, Telangana and Odisha. Up next, we'll take a look at the COVID-19 situation in the country. As per the data by Ministry of Health and Family Welfare, during the last 24 hours, 10,215 COVID-19 patients were cured. A total of 1,80,012 patients so far have been cured of COVID-19. The recovery rate has risen to 52.47%, which is indicative of the fact that more than half of positive cases have recovered from the disease. Currently, 1,53,178 active cases are under medical supervision. The testing capacity for detecting novel coronavirus in infected persons in the country is continuously being ramped up. The country now has the capacity to test 3 lakh samples per day. Total number of samples tested so far is 59,21,069, with 1,54,935 samples tested in the last 24 hours. A network of 907 labs has been created in the country as per today. Now, this includes 659 labs in the government sector and 248 labs in the private sector. The Ministry of Health and Family Welfare has issued a detailed, illustrated guide to address the issue of stigma faced by people affected by COVID-19, including patients recovered from the disease, frontline healthcare providers, their families, etc. Importantly, ways to reduce stigma have been illustrated, which include various do's and don'ts. The do's are: be appreciative and supportive of the efforts made by frontline workers, verify information from a reliable source such as the Ministry of Health and Family Welfare before sharing or forwarding it, and the last but not the least, share positive stories of those who have recovered from COVID-19. Remember, do not spread misinformation, do not label any individual, group or area for the spread of COVID, and do not spread name, identity, locality of persons infected or under quarantine. Ministry of Health and Family Welfare has addressed the states and union territories to engage with private healthcare providers to facilitate enhanced bed availability and critical care health facilities, as well as to ensure fair and transparent charges for services provided. In order to ensure that patients receive prompt, good quality care at reasonable rates, it has been suggested to states to have consultations with the local private healthcare providers and arrive at reasonable rates while factoring in the cost elements for personal safety, equipment for the healthcare providers. It has been suggested that the rates, once fixed, must be widely publicized so that both the patients and the service providers are fully aware and the capacities are used optimally. A number of fake news reports relating to COVID-19 are surfacing these days. Referring to ICMR, one such news report claimed that the peak of COVID-19 in India is shifted to mid-November, when a paucity of ICU beds and ventilators may arise. The PIB fact check finds that this news is misleading. The study to which the report is attributed is not carried out by ICMR and does not reflect the authentic information. Referring to the Department of Personnel and Training, the Government of India, another media report claims that central government has postponed the increment of employees till next year. The fact-check team finds out that the order is related to the compensation of APAR and extension of time limit. It is not related to increment. This report is also misleading. The government has been extensively undertaking Mission Vande Bharat to bring back home the Indian nationals stranded in various parts of the world due to COVID-19 pandemic. Indian High Commission in New Zealand has said that the second flight of Air India took off from Auckland Airport this morning, carrying 217 stranded Indians from New Zealand. Up next, a global report on the cases of COVID-19. Nearly 81.45 lakh people have been tested positive for COVID-19, while over 4.4 lakh people have lost their lives. The US continues to remain the worst affected with respect to number of confirmed cases and deaths, followed by Brazil and Russia. Over 21.34 lakh people have been tested positive across the US, while over 1.16 lakh have died till now. Brazil is fast emerging as the new epicenter of COVID-19 outbreak, having recorded over 9.23 lakh confirmed cases so far, while Russia has reported over 5.44 lakh confirmed cases. The United States, Canada and Mexico have agreed to extend their restrictions to keep their shared borders closed to non-essential travel until at least July 21st to curb the spread of COVID-19. Non-essential travel was first restricted across the borders in March as coronavirus outbreak began to hit the US. The three countries have since extended the border restrictions, which were previously set to be lifted on June 23. The measure bans recreational travel and tourism, but allows for trade and the travel of essential workers. Americans who are returning to the US and Canadians returning to Canada are exempt from the closure, while immediate family members of Canadians are allowed entry into Canada but must quarantine themselves for 14 days. Florida Governor Ron DeSantis on Tuesday said that the state was on track to continue its phased reopening and that the reopening will not be rolled back. The reopening across some U.S. states come as new coronavirus infections hit record highs in 6 U.S. states, marking a rising tide of cases for a second consecutive week. Florida, Arizona, Oklahoma, Oregon, Texas all reported record increase in new cases on Tuesday after recording all-time highs last week. The United States currently has over 2 lakh confirmed cases of COVID-19 and has death toll surging past 1 lakh. Amid fears of another wave of COVID-19 cases in Colombia, its capital Bogota has begun easing lockdown measures with new set of restrictions. The South American country has so far registered more than 1,800 deaths from COVID-19 and the total tally of cases exceeding 53,210. As the world is inventing new ways to fight COVID-19, the UK government has approved dexamethasone to treat COVID-19 patients. Now, it is widely available and the world's first cure for the disease. UK Health Ministry said that dexamethasone has been immediately approved to treat all UK hospitalized COVID-19 patients requiring oxygen, including those on ventilators. Now, according to the ministry, the drug was proven to reduce the risk of death among COVID-19 patients receiving lung ventilation treatment by 35% and patients on oxygen by 20%. As of now, the United Kingdom has registered around 2,99,600 cases of COVID-19 infection, including more than 42,050 fatalities. In Russia, the people returned to restaurant terraces for the first time in more than 2 months as the Russian capital rolled back more COVID-19 restrictions despite still recording over 1,000 new infections daily. Moscow began to lift its lockdown last week, allowing residents to leave homes and use public transport and vehicles without restrictions. Moscow has been the worst affected area in Russia, which has the third highest number of cases in the world with more than 500,000 infections. Moscow has recorded 8,680 cases and 3,386 deaths, while the nation as a whole has registered more than 5.44 lakh confirmed cases of COVID-19, with death toll surging past 7,000. The United Nations General Assembly will be holding elections today for 5 non-permanent members of UN Security Council for 2021-22 under the new voting arrangements due to COVID-19 restrictions. India's victory is assured as it is the sole candidate vying for the lone seat from Asia-Pacific grouping. It needs 2/3 of UNGA members or 129 votes to be confirmed. Canada, Ireland and Norway are vying for 2 seats in the Western Europe and other countries category. Mexico is also unopposed in its bid for the Latin American and Caribbean seat, while there is a straight contest between Kenya and late entrant Djibouti for the African seat. Each year, the General Assembly elects 5 non-permanent members for a 2-year term. United States President Donald Trump yesterday signed an executive order that he said would reform police practices while maintaining law and order. The order stated that as part of this new credentialing process, chokeholds will be banned except if an officer's life is at risk. Additionally, less lethal weapons will be used to prevent deadly interactions. Also, stress is on improved information sharing so that officers with poor records are not hired without their backgrounds being known. Amidst continuous wave of protest against racism and police brutality, Trump expressed sympathy to the families of the victims of police violence and pledged to fight for justice, promising them that their loved ones will not die in vain. However, on Twitter, Trump has called for crackdowns on protesters and emphasized a forceful and militarized response to social unrest sparked by the death of Floyd and others.
As part of this new credentialing process, chokeholds will be banned, except if an officer's life is at risk. Additionally, we're looking at new advanced and powerful, less lethal weapons to help prevent deadly interactions. New devices are being developed all the time, and we're looking at the best of them. Under this executive order, departments will also need a share of information about credible abuses so that officers with significant issues do not simply move from one police department to the next.
Let's get to sports updates now. As the English Premier League season resumes today after being stopped since March due to COVID-19 pandemic, there will be a host of safety protocols that need to be followed. An English Football Association has come up with a suitably grand name for it, that is Project Restart. It will become the 3rd major European league to restart the 2019-20 season after Bundesliga and Spanish La Liga. Football in England is serious business, primarily because it's the wealthiest and most popular league in the world football. Just like any in tennis, the US Open tennis tournament will take place as scheduled, but it will not include fans. New York Governor Andrew Cuomo on Tuesday gave the green light for the US Open to be held from August 31st till September 13th. He outlined some of the safety measures, including robust testing, additional cleaning, extra locker room space, and dedicated accommodation that will be necessary to hold the event. While a number of top players had expressed concerns about attending the Grand Slam due to novel coronavirus, the USTA had said that it hoped to go ahead with the event so long as it got approval from the state. No professional tennis tournaments have been held since March due to COVID-19 pandemic. That's it in this edition of the News this hour. Thanks for watching. Namaskar.